All right, so let me explain about T1 and T2 relaxation time, which is typically used in clinical MRI. So they gives a different tissue contrast. So relaxation time means after excitation from an equilibrium state and how they recover. So this is a diagram showing that the Z direction is the original axis, and once you give a RF perturbation, the magnetic dipole moments are on the XY, but overall it will recover to the original Z direction. So that's what T1 relaxation time means, recovery of this longitudinal orientation. So initially the longitudinal component is 0, and then it gains back. So we want to measure that relaxation recovery time. And this we call spin lattice interaction, and this is along the static magnetic field. And T2 is a little different. T2 measures on the XY. So this is on the transverse magnetization, and we are measuring the loss of transverse magnetization, because once it gets in and then it dephases, so that loses transverse magnetization. So this is called spin-spin interaction and transfers to the static magnetic field. So here, this more mathematical description, this is all exponential decay that we can define T1 and T2 based on this magnetization of recovery in longitudinal direction and dephasing of lateral direction. So this is an example of T1 weighted and T2 weighted MRI. You can see T1 weighted are very good white matter, gray matter, and cerebral cortex. So this is good for cerebral cortex and fatty tissue, and overall morphology is clear here. So we are using this one as a basis for fMRI later on. I'll talk about it. And this is T2 weighted MRI. You can see this ventricle inside the brain. This white strong signal is showing clearly. So tissue edema or brain edema, we can use it, and inflammation also involves a edema, and white matter regions are more clear here. So that we use T2 weighted MRI. So I want to discuss a little advanced MRI techniques, which is diffusion MRI and functional MRI. So first, this is called diffusion MRI. What you see is a big axonal tract inside the brain. So the contrast is coming from anisotropy, because this axons having a lot of myelination, and that has a very thin layer of inside the water or hydrogen atoms will have only limited directionality because of this myelination. So we take that anisotropy as a contrast, then we can have this nice fiber tract inside the brain, and even if we can actually have the directionality assigning of color, then we can have this more of information called DTI, or diffusion tensor imaging, a common type of diffusion MRI. This provides connection of axonal fibers. So the next is a functional MRI example. So this is a paper coming out and showing cortical activity during hand movement. So related to hand movement and right-handed and left-handed, and also stroke patients affected by this. So this fMRI or functional MRI is in fact, MRI is a structural imaging, but we take a fast, almost real-time MRI while doing a task so that we can find out, in fact, not directly neural activity, but indirectly the blood flow changes in that neural activity, neurally active area, so that we can use it by indirect measuring neural activity in this central nervous system. And this principle of fMRI, we call it as a BOLD, or blood oxygen level dependent effect. So with this, I'm gonna close and We covered medical imaging, X-ray, CT, ultrasound, and nuclear medicine, SPECT, and PET, and MRI. Thank you for your attention.